EEG monitors are used for observing and diagnosing a variety of neurological conditions. They include epilepsy, related convulsive disorders, and even brain death. They can also be used to evaluate the psychiatric disorders and differentiate among various psychiatric and neurologic conditions. In addition to that, electroencephalographic studies with EEG monitors can assist in localizing tumors in the brain or the lesions or near the surface of the brain. EEG monitors use electrodes placed on a patient's skull to measure, amplify, display in the graphic form, and even record the weak electrical signals which are generated by the brain. So EEG monitors, they use computers to analyze and to generate the large amount of electroencephalographic data, which are processed and displayed in various formats. These cup electrodes are usually affixed by a technician. Cup or disc electrodes are affixed to the skull with a special adhesive called collodion or with a conductive paste. Regardless of the electrode placement procedure used, the patients usually lie down, remain awake and keep their eyes closed during EEG recording. However, sleep EEG recording are also common. Ventilators provide temporary ventilatory support or respiratory assistance to patients who cannot breathe on their own or who require assistance to maintain adequate ventilation. It is maybe because of their illness, trauma, or congenital defects, or even drugs. Examples, anesthetics. Ventilators consist of a flexible breathing circuit, a control system, monitors, and even alarms. The gas is delivered using a double-dim breathing circuit. This gas may be heated or humidified using appropriate devices. The most ventilators are microprocessors that control and regulate the pressure and the volume of FiO2. This power is supplied either an electrical wall outlet or even from a battery. So the control mode provides full support to the patients who cannot breathe for themselves. In this mode, the ventilator provides mandatory breaths at preset time intervals and does not allow the patient to breathe spontaneously. So the assist and the control modes also provide full support by delivering an assisted breath. So this volume control breaths, it's a control system is used to ensure that a set tidal volume is delivered during the inspiratory cycle. So in the case of pressure control breath, regulate the flow delivery to attain and sustain a clinical set inspiratory pressure level 2. Users first check that the unit is ready for use. Then make sure that the settings are correct and appropriate for the type of the patient and his conditions. So once completed, the patient is connected to the ventilator. When the ventilator patient connection is completed, users ensure the patient is being properly ventilated. While the patient is being ventilated, caregivers monitors or evaluate the patient and respond promptly to the alarm. MRI. It is primarily used to identify diseases of the central nervous system, brain, spine, and even detect musculoskeletal disorders. It can also be used to view cartilage, tendons, and even ligaments, image the eyes and the sinuses, diagnose infectious diseases, to detect metastatic liver disease, to display the heart wall structure, to stage prostate, bladder, and uterine cancer, to evaluate kidney transplant viability, and to study marrow diseases. I know, a lot of functions are helpful in the MRI scans. So an MRI unit consists of a magnet, an RF transmitter or receiver system with an antenna coil, a gradient system, a patient table, a computer, display monitor, and an operating console. So 3 basic magnet designs are available for diagnostic MRI application: permanent magnet, the resistive magnet, and the superconducting magnet. The most systems today use a superconducting magnet. MRI units use strong electromagnetic field and radio frequency radiation to translate the distribution of hydrogen nuclei in body tissue into the computer-generated images of anatomic structures. These nuclei are normally aligned randomly in the tissue until an external magnetic field is applied and the nuclei align themselves with that field. During an MRI scan, the patient is moved into the bore of the MRI magnet, while the operator adjusts the controls and depending on the sections of the anatomy being scanned. Before the procedure begins, patients are checked for metal jewelry or other metal objects which can distort the image or cause injury.